Jai Jintaninaben. Who is taking session today?
Hey, Jason Sulubai. This week, how are you?
Doing good.
Good. This week is the revision week before the midterm exam. So somebody is taking all the sessions.
Okay.
Today's session is on pranayama. So Jajananda, everybody, while we wait for Somniji's, I think she's given specific pranayams for each of us to read up about and demonstrate when she comes. So I hope you've all read which pranayam you have. And
Naina,
yes,
I got the Bhastrika pranayama.
Okay.
Is that the one that is forceful exhale?
Bhastrika is the forceful exhalation.
So you just like do it from one. Can you show me?
Yeah, I think it can be from both nostrils or either nostril, but it's just breathing in and out. That's Bhastrika. Kapilbhati is just when you're breathing out, like it's just that stomach movement, breathing in.
Okay. So this is like for you don't close the nostrils, right?
You can close one side. If somebody is on now, maybe she'll explain.
Okay.
Either side, you can still both sides.
All right. Thanks. I'm just a bit confused. Okay, no worries.
Okay. I think I was looking up to see what her notes were about.
In Kapalbhati and Bhastrika, you can use both the nostrils. Just in Bhastrika, you have to breathe in and breathe out.
There you go.
And in Kapalbhati, you have to breathe out.
Just breathing out. It happens automatically. Yeah.
Correct.
You can do it from one nostril as well, correct or no? If you close one nostril and do it, is that still Bhastrika or that's something different?
See, that I have shown as Nadi Shodan.
Nadi Shodan, there you go. That's different. Nadi Shodan.
That is also, you can say, the short form or half of Bhastrika.
About half of Bhastrika, yes.
So, but I have given the name of Nadi Shodan, which I have learned in my study.
Okay. Right. Thank you.
Okay. So,
Samiji.
Thank you. All are ready?
Yes, Sundami, we can start our session.
For the trial.
Okay, for the trial.
Prior to
yesterday, Suril was not there. He was there.
Suril Bhai?
No, I have in a beginning and after I was not there. I had a class.
So who is the first for the demo? It is Rakesh Bhai. Rakesh Bhai has come.
Samniji.
Yeah.
Vandami Namansami Samniji.
Yes.
So I'm assigned Nadi Shodan. So, but first, I read about the articles on mudras. And the Vayu Mudra. I want to demonstrate Apan Vayu Mudra and say a couple of benefits that are mentioned in the article. So for Apan Vayu Mudra, we take the index finger, which is the Vayu, and place it at the base of the. This is the Vayu Mudra, basically. And then take the the middle finger and the ring finger, touch them with the tip of the thumb and keep the little finger straight. So this is Apan Vayu Mudra, right, Samniji?
Correct.
So there are two articles that are mentioned in the literature that you sent, Samniji. It is good for lowering the blood pressure and reducing the stress. Basically, it is good for blood pressure and people with heart problems mainly. And they have demonstrated that they have done experiments on people with heart problems. And it has reduced incidence of heart attacks in people who have practiced Apan Vayu Mudra for, I think it was 60 days. So that is the benefit of Apan Vayu Mudra. Besides what we know from what you have taught us, Samniji, that Apanvayu Mudra is good for reducing gastric problems and
Acidity.
bringing calm and reducing
Acidity problem.
any problems.
Yes.
Okay. So Nadi Shodan is my assignment for pranayam today. With Nadi Shodan, the first precautions before attempting Nadi Shodan, we should practice this on empty stomach. We shouldn't practice it immediately after having a meal. And second precaution is anyone with the heart problem should not hold the breath. There is holding the breath involved in Nadi Shodan. So anyone with a heart problem should not hold the breath. These are the two main precautions for practicing Nadi Shodan. There are two exercises mentioned under Nadi Shodan. One is a slow Nadi Shodan, and the second version of it is quick or fast Nadi Shodan. Nadi Shodan is basically purification of veins. We can increase the amount of oxygen by practicing Nadi Shodan in our blood. So these are the benefits. And as a result of this, we can bring calmness and reduce the stress. That's the second benefit. Third benefit is that we can balance, because Nadi Shodan means balancing our parasympathetic and sympathetic nervous system. So Ida and Pingla, the left and the right nostrils. So we can balance our central nervous system, both parasympathetic and sympathetic nervous system. And that way we can act more decisively. It helps in decision making and reducing the stress. These are the benefits of Nadi Shodan. To practice Nadi Shodan, we place the index finger and the middle finger across our forehead and use the thumb and the ring finger and the little finger to keep our nostrils open or closed. So for the slow Nadi Shodan, we will close the right nostril first. So use our thumb to close the right nostril and slowly breathe in from the left nostril.
Breathe in and breathe out 5 times.
5 times. And also hold the breath inside for a little while. So breathe in, hold, and slowly breathe out 5 times. And we do the same thing by closing the left nostril and breathing in from the right nostril, holding, and then breathing out. And we do this 5 times as well. So 5 times breathing in from the right nostril and breathing out from the right nostril. So first we do it from the left 5 times, right 5 times. So that's one cycle, and we should practice at least 3 cycles of this slow Nadi Shodan. And then in the fast Nadi Shodan, we do the same thing. We close one nostril at a time. So first we breathe in from the left nostril and do it at a fast pace. So it's almost like Kapalbhati, Earth Kapalbhati. So we do this 25 to 50 times from one nostril, and then do the same thing with the left nostril. So close the left nostril and breathe in at a fast pace breathe out mainly from at a fast pace from the right nostril. Again, 50 times. And do this 3 cycles of the fast Nadi Shodan.
Correct. Okay, so just it is very similar to Bhastrika rather than Kapalbhati, because we breathing in and breathing out, both are working together.
Oh, okay.
Mandami, quick question, but Rakesh ji is mentioning breathing in from just one side. Aren't we alternating it?
No, alternating is Anulom Vilom Pranayama.
Okay.
Okay, when we are just cleaning the veins of one side and the other side, so we are focusing on these 2 sides.
So on each side. Okay, got it.
Yes,
Thank you.
but not together or changing the nostrils. So if you change the nostrils alternatively, it means it is Anulom Vilom Pranayama.
Okay.
Yes.
Vandami Samriji, so breathing in from the same side and breathing out from the same side
Yes.
is what he's doing. Otherwise, you can breathe
Yes.
in from one side and breathe out the other side, breathe in from the same side, breathe out the other side. That's also the same thing, correct?
That is Anulom Vilom Pranayama, which
but-
clears the blockages or toxins in between the passage. Okay.
But Samriji, we're not breathing back in again
left
from
and
the other
right.
side. We're not alternating, just breathing in,
Yes.
breathing out. Breathing in,
From the same nostril.
breathing out.
Breathing out from the
No,
same
no, no.
nostril.
See, we have to use the same nostril to clean the veins of one side, and to clean the veins of the other side, we are
Breathe through the other one.
shifting the nostril. Okay.
Okay. So it's
Is it
not
clear?
alternating, except
Yeah.
Anulom Vilom. Okay.
Yes. And when we are clearing the passage in between the left and right side, then we are using alternative nostril.
Anulom Vilom. Okay.
Anulom
And then
Vilom.
the Nadi Shodan, and when we were talking in my notes, I've written Chandra Bedi and Surya Bedi. Is that the same thing?
Yes, that is same thing, but
Same
we
thing.
also it is not just continuously we are breathing in and breathing out. We are not practicing in that way, but we are trying to take we are breathing in through just right or left nostril at a time. If we are practicing Chandravedi, then we are using just left nostril.
Correct.
We are not changing or shifting. Clear? We are using just one nostril. That
Correct.
is the left
For the
one.
Chandra Bedi. And for the Nadi
For Surya
Shodan.
Vedi, we are using just the right one.
Okay.
We are not shifting to the left one. So
Okay.
it is because we have cold, either we have very heat inside the body. So we are managing that by using these 2 pranayams.
So Nadi Shodan pranayam is a different pranayam from those 2.
Yes, it is for cleaning the veins. Okay?
For cleaning the veins, okay.
Okay, sympathetic nervous system or parasympathetic sympathetic nervous system.
Of cleaning the nerves.
Yes.
Okay.
Yeah,
Okay.
I forgot to mention
And
that
it is for managing the heat and cold or acidity or asthma, sinus, cold. So that is these are the different issues. So for that we have to use just one nostril.
it also helps to remove toxins.
Yes.
Remove what?
Remove toxins from our blood.
Toxins, yes. For cleansing, yeah.
Yes. So it is for cleansing process, and that is for managing heat and cold energy.
The other one.
The body.
Yes.
So you're not holding anything, right? You're just doing.
That's the
See,
second
holding
version.
is always very, very good if somebody can do, but it will take time. Okay. And just once we have to see that we are cleansing the system. Okay. So our purpose is to give the exercise with some force so that it can clean the system. So holding is not very important this time when we are practicing Nadi Shodan Pranayam or Bhastrika or Kapalbhati, is it? But if somebody can do that, that is more beneficial for that, for anyone. Okay? But cleansing with force. So in force, we are not holding. We are just expediting our exercise. Next, Dinesh ji.
Jai Jinendra, Vandami Naman Sami Samniji.
Okay.
So I'm asked to demonstrate Anulom Vilom, and I think we talked a lot about it already. But very quickly, cautions, no forceful. You can hear me okay, right?
Mhm.
Yes.
All right. So in Anulom Vilom, we do not, these are the cautions or precautions. We do not breathe forcefully. It is always calm. It is always gentle. It is deep though. That's one thing. The other cautions is if you have any kind of heart condition, if you have severe cold, asthma, or any kind of sinus condition, then you should not practice this pranayam. Benefits, it helps improve lungs functions, respiratory system. It reduces stress, anxiety. It balances your breathing. It activates your brain. Those are some of the benefits by doing this pranayam. And then how we practice Anulom Vilom is first thing is you make sure you sit in a very comfortable posture. One of the postures, we were told either Padmasan or Vajrasan or Sukhasan, whatever best suits to your body. You always make sure you sit very straight. You keep your neck, your spine very straight. Before you start Anulom Vilom, just relax, breathe normally. Then you use your right hand and your left hand is always in Dhyana Mudra, like we do, we touch your index finger with thumb resting on your knee, and we use our right hand. On the right hand, we use thumb to close the right side of the nostril very gently. We use the index finger and the middle finger, which goes in the center of your head in between your eyebrows. And we use, the little finger and ring finger to close, left side of your nostril when we do Anulom Vilom. So that's how the finger positions are when we practice Anulom Vilom. So I'll just show you how we do it. I'll just first explain and then we'll do it. So you close your right nostril with thumb gently, keeping your index and middle finger in the center of your forehead here. And then you breathe in from your left nostril. And then you close your left nostril with your short finger and ring finger and exhale through right nostril. And then you inhale while you're keeping your these two fingers on your left nostril. You inhale from your right nostril, and then you close your right nostril with thumb, and then you exhale from left hand side. So we do it 5 to 10 times, and then in the batches of maybe 3 to or maybe 5 to 10 times. It depends whether you are beginner or you are advanced practitioner, but you can do it for 10 to 15 minutes every day, this practice. So I'll quickly show you how we do it. We'll keep our thumb on the right nostril, keeping your two fingers, index and middle finger, in the center of forehead, and then you breathe in. Then you close your left nostril with the little finger and ring finger. Exhale through your right nostril. Then you inhale from right nostril. Then you close your right nostril with thumb and exhale from your left nostril. Any questions?
Yes.
Any suggestions, Samniji? Any
Yes.
corrections, suggestions?
So yeah, so it is good. And this Anulom Vilom Pranayam is beneficial for all because it is for balancing the energy, cool energy and hot energy in the body. So it is good for everybody. Anybody can do this. It is not restricted for anybody, but just those people who are having some heart problem, they cannot hold. So they need not to hold. Just they can continuously breathe in and breathe out through alternative nostrils. It is also very important for cleaning the passage between the sympathetic and parasympathetic nervous system, and also balancing both the systems. So this is a very important pranayama which can be done every day for balancing the energies in the body. So it is good. Thank you
Thank you
very
very
much.
much.
Yes.
So one more thing, Samniji, I remember you mentioned about this, the Kumbhak part, right? You can
Correct.
do in Anulom Vilom as well if you are an advanced practitioner, right? You can just breathe in and you
Yes.
hold your breath for a couple of seconds
Correct.
until I mean, you should make sure there is no pain and there is no any kind of discomfort, and then you
Yes.
breathe out. And then again, you wait there for a couple of seconds and then do the same thing. You inhale and exhale from the other side.
Correct. Correct. Because for exchange of the gases, carbon dioxide is replaced by the oxygen, and for that it needs some time. So until you hold, it doesn't get time. Okay. So we are taking just a shallow breathing first of all, and second we are not giving time for exchange of the gases. So this oxygen is, instead of going throughout the body, it is coming out. Okay. So, and that's why there is a deficiency of oxygen inside the body. Our lungs are not properly breathing. The energy is also not in a proper amount in the body. So since we are not taking oxygen amount in a proper way, so that's why and holding plays very important role to spread oxygen throughout the body. Oxygen reaches out each and every cells if it gets time. Okay, so it is important. Second, I would say that this Anulom Vilom Pranayam can also be done with speed. See, for cleaning, we need some force, and that's why speed is required. So we can do this with speed, and I have shown before, but this time I can show how you can expedite it. Okay. For that, you need not to pay attention to the fingers, just you have
Okay.
to use the ring finger and the thumb.
Sure.
And change speedily both thumb and ring finger to close and open the nostrils, alternative nostrils. Okay.
Yeah.
So this
Just
can
like
also
we
be
did,
done.
just like we
Yeah.
did in Nadi Shodan, right? But Nadi Shodan, we were doing only one side. Here we are doing both the sides.
Correct. Okay. So alternative
Okay.
nostrils. Okay. So if we can do with speed, then it cleanses the internal system. It gives force, and with force, the particles or blockages, or toxins, they come out. So our passage becomes very clear. If somebody has asthma problem, sinus problem, cold problem, or any kind of problem in respiration, so that becomes clear. Anybody has any question?
I was just saying, in the fast version of Vilom, you only have to focus on breathing out. In just comes by itself. So.
Yes, when you are doing with speed, you need not to hold it. You cannot hold in between. Okay, otherwise you cannot give that much speed.
And even then, if you just focus on the breathing out, the in comes automatically, so you don't have to, right?
Yes, yes, yeah. You need not to pay attention to breathing.
We're not breathing in. Yeah.
Just you have to breathe in and breathe out. Breathe in and breathe out. Don't pay attention whether you are breathing in or out. Okay, just is how you can take get the speed. So it can be done 50 times or 100 times even in a minute. So that much speed, if we can give, then it will burn the fat of the stomach. It will clean the system, respiratory system, and all other different problems which are because of the blockages or coldness, or so that can be removed easily. Okay.
We always do into this the same count, right? Means if we did it the 50 times from this nostril, then we can do from this nostril.
This is the alternative nostril, so you cannot count once from one side. Just when you are breathing in, just you can see the how many minutes you are doing. 2 minutes, 3 minutes, till you are feeling that you are not tired or there is no pressure. So just 1 minute, 2 minutes you can do. This time you cannot count the number, but you can fix the time. You want to do 50 times in 1 minute or 2 minutes, just a minute you can fix. Okay. So one lady who had a very severe problem of asthma, and she went to all the doctors, but she could not get any proper treatment for that. She used to do this pranayam, Kapalbhati, Bhastrika and Anulom Vilom pranayam, 15 minutes. Almost, I think, within 3 months, it was clear.
Wow.
Okay. Yes. Very severe problem of asthma.
Samniji, I have one more question. So when we practice perception of breathing, so one, we focus on the normal breathing, right? Deep, slow and calm breathing. And the second one suggestion is that Anulom Vilom in that one?
Correct. So in that we are perceiving this breathing process actually. Our purpose is not pranayam for cleansing, but perception of breathing process. Clear? Sometimes the breathing comes through both the nostrils. Sometimes it comes out of one nostril. So this is happening naturally inside the body system. And there are certain times when the nostrils change or both the nostrils work together. Clear? So we are just trying to understand the nature of the breathing process. But since anytime it doesn't happen, so we are practicing through perception also. Or through perception, we are perceiving that how it goes. So perception is more important in that how you can concentrate on breathing. And I would say that it is not necessary to take long and deep breath or alternative breathing. Just you have to focus on breathing. That is the main practice of perception of breathing. Okay.
Got it.
But since our mind is not concentrated on one thing for longer periods, so we are giving some other alternatives that you can start doing this, so that your mind should be completely engaged in the practice.
Right, yeah.
Okay, so for the beginners it is necessary. Otherwise, if we give one type of technique and for longer periods, so they will get boredom, or they will come out of it, or their mind gets diverted or distracted. So if we change the practice, then they remain concentrated on that practice. Okay, so for concentration, these alternatives are also very important, and they are important in their own way, but they works in different times. When we are practicing perception, we are just trying to know the body nature or the nature of the breathing.
Somebody in perception, you don't use your fingers. It's just you're not using your fingers like this.
Yes, we are not using the hands. We are just regulating the breathing alternatively at our own will and concentration. So concentration power, you can see that how it can change the nostrils even without putting the fingers or closing any nostril or doing any other thing. at will you can change the whole system of your body or function.
Thank you.
So, though breathing is a voluntary and involuntary what we say activity of our process of our body, so you can control it voluntarily, even though it is natural, involuntary, as well as you can also control it. So it comes under voluntary and involuntary function of our body. Other functions you cannot control easily. Okay, so done. Next, who is Anita? Anita is not here.
Anita sent a text saying she's not going to be able to make it to class today.
Okay. Sachi is there? Yes, you can.
Hi everyone. So I my pranayam was Surya Bedi pranayam. So to before we get into that one, the caution with that is this Surya Bedi pranayam not induces enhances more heat, so it should not be used for someone who already has a lot of heat. So that's the caution with that one. So for this pranayam, first get comfortable in a position with your spine, your neck, your head fully aligned. And for this one, you're going to take your right hand. Your right thumb is going to go on your right nostril. Your index and middle finger are going to go in the middle of your forehead, and your ring and pinky finger are going to go on your left nostril. So when it's going to be aligned like this. I'll explain it first, and then we'll do it. So what you're first going to do is you're going to close your left nostril with your pinky and ring finger. Inhale deeply through the right. Hold for a few seconds. Close the right nostril with your right thumb. Open the left, and then exhale. And that's one cycle. So then for the next cycle, you're going to again close the left. Inhale from your right. Hold. Open your left, and then exhale. So when you start the pranayam, you want to do it at least 3 rounds, and then you want to slowly work your way up to doing 27 rounds throughout the day. So let's go ahead and do that. So you're going to close your left. Inhale. Hold. Close your right, open your left, and exhale. Let's go ahead and do one more time. Close the left, inhale from the right. Hold. And then close the right, exhale from your left. All right, thank you. And then the benefits of doing Surya Bedi Pranayam are it decreases mucus and wind, and it increases digestion and gastric heat, I believe. I think that's it. So thank you.
Okay, so is there some gastric heat? So in heat in general, okay? So
Sorry.
yeah, so it is especially it can also burn the fat of the body, and it can increase the heat if it is required in someone's body. If he is having the trouble of cold, then it is beneficial for him or her. Okay, so now the next one is Shivani. Thank you, Sachi.
Thank you.
See the scientific studies if it is done on this particular breathing exercise.
Hello everybody. So today we will be doing Kapalbhati, which is a breathing technique that translates to skull shining breath. So this technique uses forceful, quick exhalations with passive inhalations, and this serves to energize your body, sharpen your mind, and cleanse your sinuses. So while we do this move, you're going to want to contract your abdominal muscles to expel air while keeping your face very relaxed, and also create a very rhythmic pumping mechanism as you breathe in and out. So now we're going to perform Kapalbhati. So please sit upright in Sukhasana or on a chair with a straight spine, and fully relax. Relax your shoulders, your neck, and your facial muscles. So firstly, we're going to take a few normal breaths to center ourselves. So breathe in and breathe out. And now we're going to perform Kapalbhati. So inhale deeply and exhale quickly. Inhale slowly and exhale forcefully. While you inhale, you should relax your abdominal muscles, but while you exhale, you should contract them. So inhale while relaxing your abdominal muscles. Exhale and contract. Inhale. Exhale. So here are the benefits of Kapalbhati. It cleanses your sinuses and your respiratory passages, and it's also said to increase mental alertness and detoxify your body. However, if you have any of the following conditions, you might want to avoid Kapalbhati, including high blood pressure, heart problems, or an artificial pacemaker. Thank you.
Thank you very much, Shivani. Yeah, so it is rightly done. And this time, since we are learning and we are beginners in this field, but it can also be done with some speed. Okay. Yes. So you have to breathe in fully and then you have to breathe out with the speed. So that is the Kapalbhati pranayama. So it is done with some speed. So that is also very good, and it helps to reduce the belly fat especially. So this Bhastrika, Kapalbhati is important for the facial glow, and also for the storming the brain. Okay.
Okay,
Yes.
thank you.
Next, Sheetal.
So I'm going to be doing the Bhastrika pranayam. And Bhastrika pranayam is the forceful exhale of the breath. So
Inhale and exhale both.
Inhale and exhale.
Yes, with both the nostrils.
With both the nostrils.
Correct.
So Vandami, do we have to just do
Yes.
like that?
Yes. You need not to use the hands or fingers. Keep both the hands on the knee and just breathe in and out with a speed.
Okay. So we're going to sit with our spine erect and keep our hands on our knees. And then we're going to breathe in and breathe out forcefully and quickly. So when we do that, it moves our abdomen, and it helps us release our stress as well. So the benefits are it helps with digestion, and it also releases gas. If you have any gas problems, it helps with that. And then the precautions, maybe we don't want to do it immediately after meals, or with any heart conditions, you want to be careful of not doing it as well too quickly.
Yes. Thank you. Thank you very much.
Thank you.
It was good. So just in this Bhastrika, you have to take full breath and breathe out. You should not take just a shallow breathing. Okay. Use the full all the abdominal muscles for breathing in fully and also breathing out fully. Clear? So the speed should be like this. Is it clear? It should give pressure, or what we say, exercise to our abdominal muscles. You have to breathe in fully, breathe out fully. Okay? You can do continuously, but you have to breathe in full and then you have to exhale fully. So the abdominal muscles should be completely used. Okay. Next one.
Vandami Samniji, but we're
Yes.
still taking, we're not taking a full breath, right? You said to take full breath in and full breath out. How can we do that
Yes.
fast then? If we're doing full breath, then it
So
becomes
it is not that much fast. See?
Okay.
So you need not to do it very fast. It is not Nadi Shodan Pranayama. Okay?
Okay.
Clear?
So taking deep breaths.
It is to use all the collarbones, lungs, and abdominal muscles.
Okay, okay.
Okay, for breathing in fully and for breathing out fully.
Okay.
Yeah? Yes.
Okay.
So next, Nainavin.
Vandami Namasami. Sorry. So I'm going to be doing the Shitali Pranayam. And Shitali Pranayam is known as the cooling breath. So its main objective is to cool the body. So I suppose a precaution would be that if you're already very cold and feeling cold, you don't want to be doing this pranayam. You're going to be doing it when you're feeling hot to cool the body down. So what it involves is you're going to be rolling your tongue. So if your tongue out, like I'm just going to show you how my tongue is sticking out, but you're going to keep the tongue in your mouth, but just to show you how you roll it.
Got it.
Like
Excellent.
that. You're going to
Excellent.
roll it, but you're going to roll it in your mouth. I think it can stick out a little bit. It's not a problem. And then you're going to be taking a deep breath in. And then breathing out from your nose.
Got it.
And as you breathe in, you already feel the coolness that happens around your mouth. And the main benefit, as I said, was cooling the body, but then it also has a lot of other benefits. It can also make your nervous system calm and cool. So you do it to relieve any anxiety or stress. It can relieve that. It also is very good for blood pressure control. If you have high blood pressure, it can lower your blood pressure. And then it's also helpful in digestion and acid relief. It can alleviate that because the heat in the stomach, it can relieve that as well. And it can bring some emotional balance and peace to you. Did I leave anything else, Samniji?
Yes. So it is very good which you have done.
Okay.
You have rightly covered the tongue. So that is true. Sometimes we feel some thirst and we might have not water with us. In that condition, if you can
Yes.
practice this one, then it will cleanse your thirst also. Okay. So yeah. So, sometimes we are doing fasting at night. We are not taking water, and there is hot heat in the environment. At that time, you can also take the help of this.
It quenches your thirst. It doesn't takes away the feeling of hunger and thirst. Correct. Yes, I missed that one.
Yes.
Correct.
So in heat, in summertime especially, if we are doing avoiding night eating and not taking even water at night, so at that time we can use this one.
Very good.
At the time of at the time of fever, if we are feeling some heat inside the body, at that time it can also be done. So in this way, it can help us in certain conditions. Okay. So thank you very much. Next, who is going to give? Dr. Devendra or Narendra?
Yeah, I should do it because mine is Shitkari, so it's related, so better I should do it now.
Yes.
Okay. So Shitkari is kind of almost a version of Shitali.
Yes.
So in this one, the principle is similar, except you use your teeth and your tongue touching the teeth. You're going to be breathing in. It's one of the few ones like Shitali, you breathe in through your mouth and then breathe out through your nose. So you'll be taking deep breath through your mouth over the tongue with your teeth clenched. And again, abdominal muscle, I mean, I wouldn't worry about it, but you probably want to get your abdomen to come out as you breathe in, just like in Kapalabhati. So you sit in straight back as usual, and put your hands in Gyan Mudra as we don't need our fingers in the face, so you can use both hands in Gyan Mudra. You hold your teeth together and open your lips, so it looks like this, like a full smile. You hear your tongue touching the teeth at the back. There are different versions, but that's the version we were taught. Somebody taught. So you put your tongue touching the teeth, and when you take a breath in, you're going to see the air come over your tongue, very much like Shitali, except the teeth are closed, and you breathe in. So let's try it together. So the S sound will come. That's a sound, and this hissing sound is important. You breathe out through your nose. Again, one more time. Breathe out through your nose. One more time. That's your nose, and you can do it for 1 minute and slowly over time increase to 5 minutes. Basically, you should practice in the summer, not usually in the winter, I suppose, unless you're hot inside. And those who are subject to excess bile can do it anytime. So excess bile is an Ayurvedic thing, excess bile, which we'll probably talk about one day. But which is, I guess, the heat, so you can use it any time of the year. So benefits, again, very similar to Shitali in some ways. It reduces heat. It actually clears the complexion and helps in controlling thirst, hunger, and sleep. So its benefit goes across thirst, hunger, and sleep. And I think Samaji is probably right. That probably helps you feel hydrated when you're dry, like Shitali. So it's kind of a cousin of Shitali. So I think it has similar benefits there. That's it, Swamiji. Anything else? Benefits? This is
No. So you have covered that one, but just Shitli and Shitkari both work in the same sense, and they are very useful for hydrate the body. Hydrate the body. Okay. So yeah, it is good. When we are breathing in through mouth, then it is called shitakari. When you are breathing out, then it is hot kari. Okay, it is hot one. When something is what we say in cold, what happens when we feel severe cold in the environment? Then we breathing out through mouth, is it, and make our hands little bit warm.
yes.
So because the air which comes from within is little bit hot, and the air which goes from outside is little bit cold.
So what do you call the breath from the nose? What do you call that?
What you have said?
What do you call when you breathe
Hot
air from the
curry.
nose?
Hot curry.
Just I have said
Hot curry.
shitkari, and that is ushnakari, hot.
Ushna.
Ushna.
Ushna
Ushna
curry.
means hot.
Ushna we should know.
Ushna.
Like snake
There,
plant, Ushna, like that.
there is no such mention, but I am telling that we can also say that there is a ushnakari breathing exercise through which you can warm your hands in severe cold.
Oh, nice, Swamiji. Thank you.
Yes. Okay. So thank you, Narendraji. Would you like to give the station?
Vandami Namasami Samiji.
Yes. Thank you.
I'm going to present Chandra Bedi Pranayam.
Correct.
First, relax and sit straight. Keep your head and body all in one line.
Mhm.
Then use your right hand. Put the thumb on the right nostril and middle finger and index finger on the middle of the head, and the ring finger and small finger on the left side. Then we'll breathe in from the left, hold it, and breathe out from the left. We can do like 5 times. And the main benefit from that one is when you breathe is when the body is too hot, or it cools down the body, or if you got the temperature, it helps in reducing the temperature, as well as relax, as well as stimulate your mind when you breathe in and out.
Mhm.
So let's begin.
Yes.
Breathe in from the left. Hold for a few seconds. Then release from the left side. Again, breathe in from the left. Release from the left. Breathe in from the left. Release from the left. So basically, due to Chandra Bedi Pranayam, your body stays cold. If the body is too hot, it cools down and is helped in your blood pressure as well as relaxing.
Yes.
Vandami.
Thank you very much. Thank you. Thank you.
Vandami, it should be from the right nozzle, right? Not from the left. Chandra Bedi is from the right and Surya Bedi is from the left.
Chandravedi is from the left. So left nostril is Chandravedi. It is known as Chandraswar. Okay.
Okay.
Moon energy. It represents moon energy. Okay. And the right one represents the sun energy. When Chandravedi Pranayam is done, then you should meditate on the moon at navel during the holding time. Okay. And when you are doing Surya Bhedi Pranayam, then you have to meditate on the sun at navel during the holding time. Okay. And feel that the energy is increasing in the body. Clear?
Yeah.
Yes. So it is known Ida in yoga. left nostril is known as Ida nerve.
in the
Okay?
Nadi.
It represents Ida Nadi.
Yeah.
And the right one
Finger.
represents the Pingla Nadi. And when we are using both the nostrils, then it represents the Sushumna Nadi, which is the central most Nadi. Okay? So it means both the nostrils are working. It means the spinal cord is more active in that time. When both the nostrils are working together, this is the right time for meditation. Okay? If you are doing some job, you want to go to job for workplace and want to do something physically active, then right nostril should work. When you want to take rest or calm down or want to think seriously on some matter, then the moon energy would help you. Okay. And to balance the heat of the day, it is required or it is suggested that even the normal person should use only the Chandravedi, the moon, the left nostril in daytime. In night time, you have to use the right one. So that's why it is suggested that you should sleep always on left side, turning on left. Okay, so automatically the right will work. The left one will be closed. But if somebody has the high blood pressure or low blood pressure during daytime or nighttime, then they have to think that whether they are having the problem of high blood pressure, then they have to use the left nostril. And if he is having the low blood pressure, then he has to use, even in daytime, the right nostril. Okay? Even at night, if somebody is having such problems, then he has to see that if it is low, then he has to use the right one. And if he is having the problem of low blood pressure, then he has to use, high blood pressure, then he has to use the left one. Then he has to sleep on right side if blood pressure is high. Clear?
Yeah.
So depending on the problem, you have to just change. Otherwise, the normal condition is that in daytime, we have to use more and more the left nostril, because there is already sun, there is heat in the environment. And if your body is also having the heat in that proportion, then it will be difficult for you to live in such a heat. Okay? So
But
that's
Samniji, consciously it's hard to, one, I think is hard, I find it hard to know which nostril is working. Like, they say, if this nostril is more, then you can do this, you do certain activities. But even when you say we should use the left nostril, it must come with practice. Otherwise, we would have to be walking around with our right nostril closed with a finger to focus on the left.
Yes, you are absolutely true, because the beginners or the new people who are not well versed in catching the breathing process, then they have to use the hands.
Hands, right.
Yes, it is true. Those who are well versed and very deep into practice, they need not to do everything. They can see that which nostril is working this time and how I have to shift it. They
That's
are
amazing.
well versed, they are expertise. Okay,
right.
Even I cannot change easily because I'm not practicing in that way. The experts practice.
Thank you, Samniji.
There is a complete astrology based on the breathing process. Okay, looking at the nostril, the length of breath, someone can say about your future. Okay, about your so if you are going to do some if you are going to start some new thing, and if you are asking the astrologer, he will check the breathing and will say that whether it is good for you to start this work at this time or not. Okay, so the whole astrology is working on this particular breathing process. What kind of elements is working in particular time in the breathing, what kind of color is there, what kind of length of the breathing is there, what kind of a smell is there, so how it will work or not. So the whole astrology is based on this particular thing. So it is known as Swar Vigyan. And there are several videos you can find out on internet. Rajiv Jain, he is a very good expert of Swar Vigyan, and there are several other experts of Hindu tradition. So they are talking a lot about it. So according to them, it is Lord Shiva who has taught this particular astrology. Okay, how you can check your nostril and can see, know about your own future or results of your action which you are going to take.
Vandami, does the nostril cover the opposite side of the brain? Like if your right nostril is breathing, then the left side of the brain is active? Is that what it is?
Yes, it is said. So Acharya Mahapragati used to say that we are just using one part of our brain, and that is the left part, but not right part. So if we use this breathing process, then we can balance the brain function also. Yes. So a lot of benefits of this breathing process. So whenever you get some time, you just can see Swar Vigyan, how the astrology is working based on the breathing process.
Oh, thank you.
Okay, so anybody else who is left? So I think all have given. Is it? So should we stop here or we have to do meditation? Should we stop?
Samiji. I have drama practice.
Okay, so thank you.
Suril escaped, but Suril should do one.
What do you have said?
Suril escaped. He should do one.
Yeah, so whatever you can tell me, let's do, and then after I will
Okay,
work
so
for that.
you can say about the what we say Anulom Vilom Pranayama.
So Anulom Vilom Pranayam. Okay, whenever we do Anulom Vilom Pranayam, we
Rakesh,
suppose
you can leave.
Okay, thank you. Vandami namaskar.
Yes.
Yeah. So whenever we do Anulom Vilom Pranayam, we suppose has to be sit in a Sukhasana, very relaxed one, and make sure that our spine is totally erected, straight one. And then after, we can have our breath slowly in, and then take it slowly, releasing it up, down. Okay, and that's the things we can do at least 3 to 5 times in a row. Main benefit with this one, Anulom Vilom, is whenever you are taking a breath from the one nostril, and then you can take this from the another one out and repeat it. So it will be cleanse not only your entire respiratory systems, but also it means it's that's, yeah, I think its main benefit is to clean the respiratory systems and strengthen your lungs.
Yes.
So
yeah. Now you can explain the method, how it can be done.
yeah, so whenever we'll do, we can use our these 2 fingers, right? Means the first index and one. Keep it up that one, and then the another rest one. You can we can start from this either right or left side. So whenever we'll do, we close the one of our nostril, take that inhale from the one nostril, block that one, and then from the opposite side we exhale it. Same thing, we repeat it for this the couple times, at least 3 times or 5 times. And then after, once we do from the one nostril, then we change it to this the another one, and then we do the we inhale from that nostril and exhale from the outside. We do these things to balance it out, our respiratory system. So if we want to do, we can do. Whatever is you are comfortable, you can start either from the right nostril or from the left nostril. You can block it with your thumb or with your 2 fingers, and then inhale slowly. If you can hold it, it will be much more better and give you a benefit. You can hold your breath a little while, and then after you exhale it from the opposite nostril. So I will start with the left nostril, and then I can block. So let me block my right nostril with my thumb. You are able to see it, and then I inhale, hold it, block with my 2 finger, and then exhale it. Now again, I block with my thumb. Hold and exhale. And then after we can just again, so if I started from the left side, then we can do it again from the right side to balance it out. So that means block our left nostril, inhale, hold, block the left nostril, take it out from the right. Okay. Inhale, hold, and take it out from the right. Inhale, hold, take it out from the right.
Thank you, Sarul. Just we are breathing in through one nostril and breathing out through another one, and again we breathing in through the another one, the same one through which we have breathed out, and we are breathing out the opposite one from the opposite one.
So it's not the alternate way, means it's breathing from the same 3 times and out, or?
Yes, and through which you are breathing in, out, you have to breathe in.
Okay.
Okay, so this is the process, and it is for cleansing the passage between the 2 right and left nostril, or you can say sympathetic and parasympathetic systems. Okay, and also the balancing the sun and moon energy in the body. Correct. Heat and cold. So it is good. Thank you very much. You all are practicing very good. And just to be clear that first you have to explain the scientific base if it is available in any article which I have provided, and then you have to say about the method, what is the what it is, what is the meaning of the particular word Surya's Bhedi Pranayam or Chandra Bhedi Pranayam or like this, and then you have to explain the method, and then you have to say about precautions and benefits and precautions. Okay, so step by step everything should be covered.
Samniji, for tomorrow?
For tomorrow I have assigned already the physical exercise.
Yeah, so I see, the numbers there 1 or 2, so I'm just trying to understand.
Oh yes, it is true, because that text is already posted on the Google Classroom. Might be you have noted, and as soon as you will open the content page, you will see that exercise number 1, exercise number 2. It is visible.
I tried to figure out, but
okay, just
It's
see
the ones in the books in here.
that it is
in the
given
book. Okay.
Yeah, it is given in the same way in the book. That's why I'm given that Roman number.
Okay.
Is
so
it
is
clear?
that blue book? Yeah, okay.
Yes, the blue book. The blue book. So it has
Yeah.
exercise number 1. So that
I
is
have
for
this.
head. Exercise number 2 means for eyes. Exercise number 3 for soldiers, like this. Okay. So since it is given in this way, so that's why I have put the same. But if you think I can add the exercise, eyes or
No,
head,
it's good.
shoulders or like this, so that you would be clear. Okay, so I will
Yeah.
aid and post it again.
Sure.
So
Okay. I understood now,
yeah,
Samiji. Thank you very much.
exercises of spinal cord, exercises of here of his left
Yeah. Yeah. For
abdomen
me, it's
and
eyes.
breathing,
Okay.
abdomen and breathing. So it
Yeah,
is
I have this.
these are the precise, but the other ones I did not put the particular name of the exercise, but because number is given, that's why I have already
Sure,
said.
sure.
Okay, thank you.
Okay, so come up with that, and all the meditations are also assigned. Everybody has to come up with the proper steps of meditation, or yes. So first
So,
step, second step, third step, fourth step, whatever is in particular meditation. So be
so
clear.
meditation will be done on the next day then? Tomorrow is
Yes.
the
Tomorrow is
exercise.
exercise, subtle exercise, okay? Yogic exercise. And
And
day
then
after tomorrow is meditation, and then we will discuss about the quizzes.
quiz. All right.
Okay.
Okay.
We will revise the quizzes you already have already taken, but you can just see if you have no clarity about any question. If you want to know, you can just ask me that this question is not clear, or if you want to know more about that, you can ask about that also.
Sure. And during the midterm in a Samniji, then this will be the same thing we will be doing in
Yes,
practical way.
yes, the same thing. Okay, so just come up with the proper study.
Yeah.
This time I am correcting
Right.
for revision purpose. Okay, but
Mhm.
at that time I will not correct. I will deduct the score.
Sure.
so, so it may be minus number.
Sure.
So you have to be very much methodical and very what we say accurate in your explanation. So be clear that first to come up with the scientific. First you have to explain the meaning of the particular term which is given to particular exercise, whether it is breathing exercise or physical exercise or mudra or any other meditation. So first you have to be clear about the meaning of the particular term which is given to particular practice. Then you have to
Sure.
say what scientific reason we have to practice for it, this particular thing. And next you have to say about the method, how it can be done, can be practiced, and what are the precautions and what are the benefits. Okay.
Sure.
In
So
this
one
way,
mudra,
in five,
one.
in
Yeah.
5
Sorry.
steps, you have to cover everything.
Right. Right. Yeah. So Samniji, one mudra, one
Yes,
pranayam, one
correct.
yogic exercise, and
Correct.
meditation. So 4 things, and then quiz you said will be on Monday, right?
Yes, I will release the quiz on 11th after completing the exam and your yoga session, and you can take any time in a week.
Okay.
Okay,
Sure.
just it will be open for 1 week, but
All
it
right.
will
Okay.
open once only and for 1 hour only. Okay,
Perfect.
as soon as you will open, and if you will not take the quiz, it will be closed.
Close call.
It will not now open next time.
Sure. Thank you, Samniji.
So be clear. Whenever you are ready, you can take in any time in a week.
Yeah.
Okay, but it will be released after 12 p.m. of 11th.
Thank you very much, Samniji. Vandami Samniji.
Yes. Thanks.
Mandami namasami samiji. Kutagesi.
Nandami namasami samiji. Thank you.
All are doing good. Just
you,
go to
Samiji.
the scientific articles which I have provided, or you might get more scientific standard quality papers on internet. Try to know about your own exercise. And Dr. Devendra has already discussed so many scientific studies on some meditation and some yoga exercise. So you should also pay attention to that, but you can also explore on internet. So many articles, so many websites, so many informations are available.
Sure.
But first you have to cover whatever is given in Precaution meditation system, so that at least you must have command on your own
Yes.
system.